Hello everyone, Dr. Hall here, continuing lecture 23 on non-sexually transmitted GU infections. In this next part, part C, we're going to talk about vaginal infections, and we're going to focus on two, Candidal Vaginitis and Bacterial Vaginosis. There is a third common vaginal infection called Trichomonas, and that is actually a sexually transmitted infection, so we'll cover that later when we do the STIs. So first of all, we have to remind ourselves of what is normal in the vagina. And so it is normal in the vagina to have bacteria present in the vagina, not in the uterus. The uterus is normally sterile, but inside the vagina, we normally find lots of bacteria. And in particular, we find lots of a certain type of bacteria called lactobacillus. So this slide that we're looking at here is showing us this is a vaginal cell, right? This is a smear taken from a vaginal sample. This is another vaginal cell. You can see the nuclei in the middle, that darker pink, right? And then we have these little rod-shaped bacteria. Those are lactobacilli, and these bacteria help to keep the vagina healthy by doing a couple of things. One is they actually produce hydrogen peroxide, and that's a mild acid. It reduces the pH in the vagina to about 3.5 to 4. That reduced pH helps discourage the growth of other unhealthy type of bacteria. It also, as we've discussed, presents a challenge for sperm, and so that they don't get destroyed by the acid, which is why semen has to be slightly alkaline to help counteract that and protect them. So these lactobacilli maintain an acidic pH in the vagina. They also outcompete other potential bacteria or fungal organisms for resources, and therefore keep other populations suppressed. So in a normal, healthy vagina, you have this nice balance. You have lots of lactobacilli keeping things acidic and keeping other potential microorganisms in check and preventing them from overgrowing. So remember, bacteria are normally present, usually these lactobacilli. They make lactic acid, keep the vagina acidic, which inhibits the growth of other organisms, and then they also outcompete the other organisms. They also release hydrogen peroxide, which also has an antibacterial action against many types of bacteria. So there are other organisms, other bacteria, fungal organisms normally present in the vagina, but they're typically in very low numbers. They really can't get very far because of the lactobacilli. And so as long as you have a healthy environment inside the vagina, these other organisms usually can't grow in any significant numbers or cause problems. But if the lactobacilli are impaired, or if the pH gets altered or thrown off for some reason, this can disrupt that balance and allow other organisms to overgrow and cause problems. So the first one we're going to talk about is one that we talked about when we talked about genital skin infections, and that's Candida. So Candida can not only infect the skin, but it can also infect the inside of the vagina. So this is what's classically called a yeast infection. If you get overgrowth of the Candida albicans organism, that yeast organism, fungal organism inside the vagina, it tends to cause itching and a thick kind of clumpy white discharge. So what we're looking at here is we're looking through a speculum at the inside of the vagina. Here's the little remnant of the hymen right here. And then so this is the cervix at the top end of the vagina. These are the side walls of the vagina here. And so we see this kind of clumpy white discharge, and it can smell kind of yeasty, right? Kind of like bread, and it can cause a lot of itching. If it gets severe enough, it can also cause pain and inflammation. So the treatment for a vaginal yeast infection is to use an antifungal cream, usually applied inside the vagina, that comes with these little tubes with these little inserters, and you kind of squirt the the cream inside the vagina. There are some one-day preparations that are out there, and it's a large dose. It's usually this ovule. It's like this little egg-looking thing. So there are some one-day treatments out there, but I have to say that I've seen a couple of things happen with the one-day treatment. Is that, for one, it's a high dose, so in some people it causes a lot of irritation on top of something that's already irritated. It can be very uncomfortable. The other thing we find is that sometimes just one day of treatment isn't enough and the infection ends up coming back. So most of the time you're a bit better off picking a 3-day or a 7-day treatment regimen. These are available over the counter. They're very safe to use. You also want to try to avoid anything that's going to increase your risk for a yeast infection. So again, Candida and other yeast love warm, moist environments. So trying to keep the vulvar area as cool and dry as possible. And changing out of, wet and sweaty clothes as soon as possible. But the other thing that's a risk factor for Candida that you can't always avoid is taking antibiotics. And the reason why taking antibiotics for something like a strep throat or a folliculitis, right, any type of oral antibiotics that you take, they can kill those normal healthy lactobacilli. And so if you kill off those normal healthy lactobacilli that have been maintaining the status quo in the vagina, then the Candida can overgrow and cause this infection. So this is a vaginal yeast infection, will often happen along with a vulvar candidiasis, right, and the skin. And so it's when this yeast organism that's normally present in small amounts overgrows, usually to some type of disturbance in the normal vaginal ecosystem. This is really common. Most women get at least one vaginal yeast infection in their lifetimes, if not several. So risk factors, as we mentioned, would be antibiotic use, because that kills off the normal healthy lactobacilli, or anything that keeps that area even more warm and moist than usual. Symptoms: itching and discharge, which is usually thick, clumpy, and white, and they may also have pain if it's severe. So how do we diagnose it? Well, certainly we can take a look on exam. We can actually take some of the discharge, look at it under the microscope, and see those yeast forms. Sometimes if somebody's had this before, they can be like, oh, I know what this is, right? Or if you were taking antibiotics and you'd been told this might happen, you can be like, aha, it has. And so you can just use over-the-counter antifungal yeast infection treatments. So treatment are these antifungal creams. The one-day creams, I do not recommend them. Usually a 3 or 7-day regimen tends to work best, and they usually work really well for most people, along with keeping the area as cool and dry as possible. Sometimes if these are really severe, if there's a lot of accompanying inflammation, we'll use a prescription antifungal pill. That's not typically necessary. Oh yeah, I don't recommend the one-day ones. All right, our second and final bacterial or vaginal infection is bacterial vaginosis. And so what we see here on the left is what things normally look like in the vagina with those normal vaginal cells and the lactobacilli. And then what we're seeing in this image on the right is here is a vaginal cell, but you can barely see it because there's all these little tiny purple dots. Right? These are all little tiny purple dots. Each one of these little dots is a bacterium. So this is a different type of bacteria. It doesn't have that rod shape. It's a round shape or a coccoid shape. And so this poor cell is just completely full of these bacteria. We call that a clue cell because it gives you a clue as to what's going on. So that's the name for it medically. But what we can see is this overgrowth of a different type of bacteria that normally is not present in the vagina in very large numbers. And so if this overgrowth occurs, it can cause a discharge. The discharge is often kind of grayish or whitish. It's kind of thin. Sometimes it's a little bit foamy. I think you can kind of see here. So this is somebody's cervix right here, and we can see this kind of thin, adherent, kind of foamy discharge. There is often also an unpleasant odor with bacterial vaginosis. It smells kind of fishy or like something has gone off. So these bacteria tend to produce that odor. It's called an amine odor. Interestingly, that odor often becomes more pronounced after sexual activity if you aren't using a condom, because if you add an alkaline substance to this bacteria, it causes them to release more of that odor causing molecule, those amines. So a lot of times people will say, the weirdest thing has happened. Anytime after we have sex, I get this horrible smell, right? This horrible odor. And that can be a sign or symptom of bacterial vaginosis. Bacterial vaginosis, or BV as it's often called, sometimes can cause some irritation or some itching, but oftentimes it doesn't. Oftentimes it doesn't really irritate the vagina that much. It just causes this discharge and the odor. So things that increase your risk for BV would be anything that changes the pH in the vagina or kills off the lactobacilli. And for BV particularly, the pH seems to be a prominent risk factor. So if you think about what might skew the pH of the vagina from acidic to more alkaline, right? And so there's a couple of things. One is semen. So if you are having intercourse without a condom and semen is being regularly deposited in the vagina, that can increase the pH, make it less acidic. That can increase your risk. The other thing is if you have very long or heavy menstrual periods. Interestingly, the pH of blood is about 7.4. So if you have a lot of blood sitting in the vagina for long periods of time or coursing through the vagina for long periods of time, that also can throw off the pH. Finally, sexual activity in general tends to increase your risk of BV. We also see it in female-bodied people who partner with other women or other female-bodied people. So any type of sexual activity seems to increase the likelihood. The treatment for BV is a particular antibiotic which can be used vaginally or taken orally. It's different from the types of antibiotics we would use to treat an STI or a sore throat or a skin infection. So it's a very particular type of antibiotic that usually works quite well. So BV is this overgrowth of unhealthy bacteria. It usually happens when the normal balance is off, particularly if the pH gets changed. This is also very common, right? So it occurs in most female-bodied people at least once in their lifetime, and 30 to 50% of people are going to have it at least once more, if not multiple times. Risk factors: multiple sexual partners, female sexual partners, and anything that increases vaginal pH. So semen being deposited in the vagina or prolonged menstrual bleeding can increase risk. Symptoms: usually kind of a thin gray to white, maybe foamy discharge, and an unpleasant odor that can be more pronounced after intercourse. There may be some discomfort or itching, but there may not. So to diagnose this, we can look and see the discharge in the vagina on exam. We'll look at that discharge underneath the microscope. We'll see those lots of round bacteria that are just kind of obliterating the vaginal cells, and the pH will be elevated, so we can test for that too. The treatment is antibiotics, as mentioned, and these are kind of different antibiotics than what we usually prescribe, and they can be used vaginally or orally. We'll also try to kind of reduce risk factors, so using condoms with intercourse if you have a male-bodied partner can be helpful. And interestingly, NuvaRing, which you've learned about as a combined hormonal contraceptive, has been shown to reduce your risk of getting BV. So we think that extra estrogen sitting in the vagina helps the vaginal cells to stay really healthy and to kind of persevere and help host those lactobacilli. We're not sure exactly why, but for people who have trouble with recurrent BV where it keeps coming back, oftentimes switching to NuvaRing as their form of birth control can be really helpful. So Candida and BV are by far the most common causes of vaginal symptoms. As I mentioned, most female-bodied people will have both of them at some point in times in their lives, not at the same time, right? Now, trichomonas, which is an STI we're going to talk about later, is common in certain subpopulations. So this is another example of community prevalence being important. Trichomonas is very rarely seen here in northwestern Wisconsin. I've been working here for 8 years. I have never diagnosed it in one of our patients. It's much more common in the southern United States and in some urban areas. So again, community prevalence is really important when you think about what infections you might be at risk for. But also keep in mind that other things can also cause inflammation, irritation, or infection of the vagina. So certainly irritants and allergens. So if somebody has a latex allergy, or you can get irritation from lubricants, especially some of those lubricants that are sold as kind of the tingly ones or the fire and ice ones. They have chemicals in them that can be really irritating. So while they may be exciting and fun, they can also sometimes be horrible. I've definitely seen some women who had basically chemical burns from some of these products, and they had significant pain and swelling that took a couple of weeks to heal. Spermicides can also cause irritation, and sometimes you can even be a little bit allergic or irritated by a partner's semen. It's uncommon, but it can sometimes happen. Strep bacteria can sometimes cause a vaginitis as well. A slightly different strain than the kind that causes strep throat, but very similar. So that's another possibility. And then there's a third thing called DIV, which is a problem with the immune system. And it's kind of like eczema, which people get on their skin, but inside the vagina. So there are other causes of vaginitis as well beyond kind of those big three. Finally, I just want to mention it's really important to differentiate vaginal from vulvar symptoms. So you know, one of my pet peeves is when somebody's talking about the vulva, but they call it the vagina, right? And you can't see the vagina from the outside part is the vulva. And so aside from Candida, which can infect either the vulva or the vagina or both, for the most part, the things that can infect the vulva, those genital skin infections, are completely separate and different from the things that infect the vagina. And so always, if you have these body parts and you're visiting with a healthcare practitioner because you're having some symptoms, be really clear about exactly where those symptoms are, because the potential diagnoses are going to be very different. Okay, so in summary, normal vagina has lots of lactobacilli that keep the pH low, keep the vagina acidic, and keep out other potentially unhealthy organisms. If you get out of balance in the vagina, then these kind of bad luck infections, these non-STI bacterial and yeast infections can occur. So Candida is the yeast infection. You get overgrowth of these fungal elements because of a lot of warmth and moisture or recent antibiotic use. It can cause a thick, clumpy white discharge and some itching. And the treatment, most of the time, over-the-counter antifungal medicines work really well. I recommend a 3 or 7 day regimen. Occasionally we need to use prescriptions, but not usually. Bacterial vaginosis is this overgrowth of unhealthy bacteria, not the lactobacilli, other types. Risks include sexual activity and anything that raises vaginal pH, such as extensive or prolonged contact with menstrual blood or semen. Symptoms, kind of a fishy or foul or unpleasant smelling discharge, and sometimes some mild itching or irritation. And the treatment for that is going to be some prescription antibiotics used either vaginally or taken orally. So that's it for the vaginitis subsection of our lecture. And then next, we are going to move into an introduction to the sexually transmitted infections in part D.